So should we start?
Yeah, I'm good.
Just give me a minute, please. Yeah, good evening, everybody. Welcome to this evening episode of cGRIP, which is cGRIP 2 today. Very interesting topic, climbing the pathology ladder with PDCC. PDCC in Oncopathology at the famous Tata Medical Center, Kolkata, opportunities and prospects. And to talk on that, we have the chief architect of this course, the person who has actually set up the whole place and is the person who really takes a lot of interest in teaching and research. We have Dr. Paramita Roy, who's an MD from IPGMER, Kolkata, former fellow of the University Network Canada. She's a senior consultant in environmental pathology at Tata Medical Center, Kolkata, with multiple publications in national and international journals. And I think we all know she is a very famous histologist from the country. Before I ask her to start, let me request you to keep your mic muted, your camera off, and please don't share your screen. With this, let me request Dr. Roy, ma'am, please share your screen. I'll just help you out. Just press on that center arrow, which is the present now arrow,
Yeah, and
and then
I
press on that your entire screen. Then
that's right.
press on the center of the screen and share. Yeah, we can see your screen, ma'am. Just share your PowerPoint and we'll start.
Can you see my presentation?
Yeah, just press that hide thing, that the pop-up will go away. Yeah, oh, okay, you can just reopen your PowerPoint, please. Yeah, perfectly fine, ma'am. Please start. Thank you so much.
Okay. So thank you, Dr. Nadeem, for this kind introduction and for this invite. So over the next half an hour, I'll give you a brief idea about the PDCC course that we have at Tata Medical Center. So Tata Medical Center, I think some of you will be aware, is a tertiary care cancer hospital in Kolkata, and we cater to the eastern zone in the country. We started off as a small center having about 200 beds, and last year in 2019 we opened a second wing. So we now have 431 beds. We have nearly 1,000 patients who come into the hospital every day, and so all our details are available on our website. That's tmckolkata.com. And that is what you can visit to know more about the lab and the process of how to apply for PDCC. The histopathology lab has 7 consultants, and currently we have 9 fellows, which includes 4 PDCC Oncopathology seats. And we are hoping to increase our strength by 1 more fellow this year. We see about 12,000 biopsies, and by biopsies, I mean a lot of big cases, big specimens, oncopathology specimens, so which are complex. So they amount to a lot of workload, even though the number looks small. And we do about 4,000 cytology cases a year. So what is PDCC? So the postdoctoral certificate course was started by the Indian College of Pathologists. We started this course about, I think, 4 years or 5 years back now. So ICP started as a college of esteemed pathologists, and they decided that if they can streamline the post-MD training in India, that would be the way forward to give a proper guidance and direction to pathologists after their MD training, which would make them mature enough to be consultants who can report. So that was the idea behind starting it. Initially, a few colleges in India had it. I think Chandigarh had a PDCC, and they still have it in Renal. Pathology, and Hinduja had one in Oncopathology. And over the years, we more and more institutes have appreciated the value of this course and the exit exam, that formal exam that it entails. And recently, last month, Vishal was speaking on the Euro Oncopathology PDCC course that he has started at his center. So these are very useful for students to do after MD. The way to apply is for PDCC in our hospital is through our website. You have to apply to TMC Kolkata, and our ad is already up, I think, in our website. We are going to be having an interview in either end of March or April. So PDCC allows twice a year joining sessions. There's a January session and a July session. At Tata Medical Center, we are only taking fellows in for the July session. And this is a 1-year course in oncopathology, and the admission process is an interview, which is the same as for our regular fellows. In addition, so to enroll for this course, at the interview, you will be, there's going to be theoretical questions, and if over the last 2 years, because of COVID, we've only had online interviews. But if it's going to be physical this year, now that we are normalizing, there could be a slide test as well. So after you clear that interview and entrance process for fellowship position at TMC, you will be offered this added thing of PDCC. If you are willing to go for the PDCC course, there will be this formal exit exam, which is the only thing different between our regular fellows and the PDCC fellows. If you want to enroll for this, and if you qualify for this, then the process is you have to apply then on the ICP website and fill up a form. There's an admission fee of 10,000 rupees and an exit exam fee of 15,000 rupees. And the examination usually happens at the end of 11 months, that's in June. And again, it's a very structured examination. There's a theory paper, which is of 100 marks, and a practical slide test, along with you're going to be assessed on your grossing skill, weightage on that as well. And pass the exam, you get your PDCC certification and a certificate of training from the host institute, which is us. And at AppCon, at the end of the year in December, there is a formal ceremony where the certificate from ICP is handed over to the fellow. And usually, always there is an external examiner who comes in to TMC along with the internal examiner and guide, who will be assessing your performance over the year for this certification. So if there are more questions or anything that you want to ask me about this process of application and of the certification, I'll be glad to answer at the end of the talk. I want to give you a brief idea about what this course and this experience entails at TMC. I like using this quotation from Dr. Susie Kurian, who was a senior consultant with us, that hard work never killed anyone. She used to keep telling our fellows, and it's really true. This course, the fellowship program at TMC, is very labor intensive. It's hard. There are no weekends. You have to come in early, and you basically eat, sleep in the lab. But it's really worth it. At the end of that 1 year or 2 years of hard work you put in, like I was told when I was a fellow at TMH in Mumbai, that you can then start grossing even in your sleep. You are so used to doing it, and with the volume of work and volume of experience that you gain in this fellowship, it will really benefit you as a pathologist. So I will tell you about our curriculum, and the fellow is expected to fill in a logbook where all the details of the grossing experience, the cases that they're seeing, the presentations that they're doing, the classes that they have attended, these have to be maintained. Apart from the clinical work, the fellowship also involves research and the exit exam. A big part of the training at TMC is teaching fellows how to gross properly. This is one thing which is lacking in MD training in various places, and rightly, I mean, the MD is a 3-year program which crams in hematology, histopathology, clinical pathology. It's just way too vast to focus on all these details in 3 years. So it is very necessary that pathologists after their MD spend at least 3 years of senior residency, and I think currently it has become practical, at least in our hospital, it is a norm that you cannot apply for a consultant position if you've not done 3 years of senior residency or fellowship. So if you are looking to work at an oncopathology or cancer center, and these job opportunities are really opening up across the country because cancer is exploding like a pandemic almost nowadays. The most important thing to learn in this fellowship is how to gross properly. If you have not grossed your specimen correctly, you cannot report. Your report will be as good as the grossing. And once you have messed that up, it's very difficult to go and correct it later. So that's one important thing that we teach. And we get a wide array of specimens here and a very good load. And apart from neuro, I think we have in-house surgeons for all sites. And we do complicated surgeries here. Reporting oncopathology is very protocol based, so that's another thing you learn here: how to use protocols, how to report structured system of reporting, using synoptic reporting, doing the staging on reports. So and the most commonly we follow the CAP guidelines, so that's both for grossing and for microscopy. And just like in cancer treatment, it's all very streamlined and protocol based. Similarly, for pathology is also very protocol based. One thing we notice when fellows come here after right after MD is they don't know how to report. They know the classification of tumors, they know all the molecular markers and the pathophysiology, but they don't know how to simply word a non-ambiguous, succinct, crisp report which is communicated clearly to the clinician. So that's one thing we train our fellows to do. They don't use extra adjectives, don't use ambiguous terminology, and you're writing your report for the clinician. So what are the salient points? What is the minimum data set to be reported? What are the important prognostic parameters? In which things do you give extra weightage, and on which histopathological, morphological features you can overlook and not give importance to? So those are the things to learn in our fellowship. This is I've given a snapshot of our pathology and path reporting system. I'm proud to be this part of one of the first completely online hospital in the country. So when we started in 2010, we were a paperless hospital, and our electronic medical records, our radiology, our operative notes by the surgeon, everything is just a mouse click away. So it's not only something to learn, it's something, a system to inculcate for later wherever you go to practice. You might be working in a standalone lab where you don't have the comfort of picking up the call and speaking to the surgeon at very easily. But the importance of clinical, the clinical picture, the whole patient as a whole is something that you appreciate when you do cancer reporting, how things can completely change depending on the history of the patient. So we should all definitely remember and learn in the process of this fellowship how much of a clinical specialty pathology is, and that is enforced even more at the MDTs. So we have about 10 MDTs per week. The fellow is required to do the entire workup of the MDT case list. So sometimes there are nearly 50, 60 cases in an MDT. So they have to pull out the history, they have to pull out the pathology report, and if there is any discrepancy, they are expected to take the slides there and show the clinicians and the team members close margins, diagnostic discrepancies. So MDT is a wonderful place to learn the importance of pathology, the importance of the work we do, and the clinical role we play in managing the patient. So just as in life, so is in reporting. Honesty and integrity are things we hold very highly at Tata Medical Center. It's very important that you are honest in your reporting, and that's another thing we train our fellows. And you have to train right from the start. If we have everybody is human, we can make mistakes, but for patient care, it is important that you own up to the mistakes. So we have quality control systems in reporting. We just like NABL also requires 30% of our cases, you have to show somebody else, get a second opinion, get validation. If we have reported something on frozen, we have to, for every case, match it with the permanent. And if there was a discordance, this is our quality assurance section of our NPAT system, where we have to say whether the report was concordant or discordant and give the reason. We do the same thing for outside reports versus TMC in-house reports, for cytology versus biopsy, prior biopsy versus the big specimen resection. For every thing, we do a quality assurance. So apart from reporting, there are various lab processes that the fellow learns. NABL accreditation involves various quality steps that are followed, and we encourage our fellows to participate in all of these. We participate in multiple EQUAS programs, external quality assurance programs for IHC, for cytology, for histopathology, and our fellows also participate in seeing these slides and assessing their standards. Another important part of the Oncopathology PDCC course is the cytology rotation. So we include only histopathology and cytology in our curriculum. We also have a bit of bone marrow exposure, but hematology and the other branches are not included in this course. So the fellow is expected to go for adequacy testing for both guided and non-guided procedures. And we have EBUS and US FNAs, and these are very expensive procedures, like costing about 20 to 30,000. And their accuracy of reporting depends on the fellow's ability and skill to do a proper on-site evaluation. So that's a big area of learning in our course. So this was a quote from my mentor in Toronto. He was Spanish, and with his accent, he used to say, if you stop reading in pathology, you are finished. So this is one thing I keep reminding myself, and we have a great learning experience, both as or any new update or classification change, new entities. These are discussed at the MDTs. The PDCC exam, Dr. Nadeem, I've taken the liberty to share your image from 2021, is the main thing that differentiates our regular fellowship training program from the PDCC fellowship oncopathology program. And that makes a big difference, because once you have that formal exam on your head, it forces you to study more. It forces you to make sure you are not cutting corners. And this evaluation is quite intense. And it's also an evaluation for us at Tata Medical Center. It's an evaluation of our quality and our ability to teach the fellow properly, that whether we have succeeded in doing a proper training of our fellows. It's a good 360-degree evaluation that the PDCC exam and this course gives us an opportunity for. And that was actually the intent of starting this course in TMC, that we would have an external validation of the quality of our training. Um, PDCC and also us at TMC, we encourage research and studies for the fellows. We at least one study should and publication per year is required. Um, our fellows and have done that, and they have presented in national and international. I've shared a picture from the 2019 US CAP. We won Best Paper awards and KC Basu Malik awards. So it's a very rewarding experience to participate in studies and do this. And this is the age and the time to do it, because later that will develop your love for pathology, love for research, and to go beyond the clinical work. So we also encourage for our second year fellow, we have a system of 1 month sabbatical where we have sent our fellows previously to even other centers across the country or to a different part of the lab. So we have a very well equipped hematology and molecular and cytogenetics lab. So you can spend 1 month there. But this is not for the first year fellows. So if you are joining our hospital and starting the PDCC course as a first year fellow, then we will not be able to give you the 1 month sabbatical off from histopathology. But if you finished 1 year fellowship as a TMC fellow and in your second year you're opting to do the PDCC fellowship, you will get that 1 month sabbatical. And as I said before, most places require 3 years of post-MD fellowship. So you can continue that at TMC, or you can do that in other places. So you have to know what is your path ahead. Are you willing to go back to general pathology, start a lab of your own, or are you going to specialize in oncopathology? Because that's and you will start forgetting a bit of your non-tumor pathology with your training and duration of stay in Tata Medical Center. So that is something you have to decide for yourself. I would also say that this PDCC fellowship can be a stepping stone for further training abroad. And that it really, there are UICC fellowships, there are many avenues nowadays which are available to pathology MD, post MD students. And this training, exposure to the infrastructure abroad, the way of doing things in pathology, it carries a huge value to both your learning and to your CV for future job opportunities. I would like to end my talk with a quote from my mentor and a guru, I would say, is that Dr. Banerjee used to always tell us that if you haven't made any mistakes in reporting, it just means that you haven't seen enough. It is important to remember that it is okay to make mistakes, but at the end of this fellowship, we hope that if we are able to inculcate that much knowledge into you, that you are at least aware of what you don't know. And that is very important to minimize mistakes. When to ask for help, when to give up, not to be too bold. Right after MD, we think we know it all. And then as in more and more you mature and you see more cases and you gain experience, you realize that how little you know. And to minimize errors, that knowledge is actually quite important. So, and we hope that you have enough confidence and experience at the end of our training program at Tata Medical Center to be independent consultants when you walk out of our doors. If you have any queries at any time, please feel free to email me or check our website for details. Thank you.
Thank you, Dr. Roy. Just please hold on. Let me just check if there are any queries in the YouTube. Since there is a few seconds delay from this transmission to the YouTube one, anyway, I think I will just get you on the screen. Right. So I think I'll ask you some basic questions which maybe some people would really like to know. First thing is, do you provide any hostel facility or boarding facility at your setup?
We help people out. So we have a guest house, so which outstation people can use, but they have to pay for it until they find accommodation. But we have no in-house accommodation option.
Right. And what about international students if they want to apply for the PDCC course?
So we do have fellows from outside the country. Fellowship at TMC is not a problem per se, but because PDCC is affiliated to the IAPM body, I think they would need registration of the APCON, whatever the IAPM membership, to get that certificate from PDCC. I would have to check that out from ICP because none of our international fellows have been PDCC fellows, whether they would allow the certification. And another thing which has changed probably recently is the amount of licensing that international pathologists are having to do, the paperwork they're having to do now to get that licensing to work in India. I think something has changed recently. So we used to have fellows from Nepal, but technically we have no issues. And even in clinical branches, we've had fellows from other countries, but that is subject to licensing to practice and all that.
Right. Let's check. Very nice presentation, very clear.
Thank you.
So as of now, you have 5 seats for the PDCC program?
4.
4. You plan to increase one, you said? No.
The thing is, till recently, ICP was not encouraging a lot of seats in one center. They were more in favor of diversifying, so they were not too keen to have more than 4 seats. But I think their trend is also changing a bit because PDCC is gaining a lot of popularity. So we plan to apply again this year to increase seats, but whether that will get approved, so far we have approval for 4.
And you are taking fellows twice a year, January and June, or you leave only once?
Our fellowship program is not very streamlined because, as we were discussing earlier, there is a bit of attrition. At the end of second year, sometimes fellows get jobs, and it's not always in their hands. And in India, unfortunately, a lot of jobs require that they join immediately. They don't allow that 3-month. Our hospital needs a 3-month notice period. So a lot of places don't allow that. So we do have to let the fellows go. So because of this attrition, we don't have it streamlined yet. We do have a July batch, but we do have some interim ad hoc interviews and admissions as well. We don't have a January session.
Okay.
And for the PDCC, it is streamlined. So I was talking about our regular fellowship, but PDCC fellows, they have to enroll for the July timing.
Right. So in the PDCC program, one very important thing which many people would like to ask is there a binding or a bond whereupon once you join, you cannot leave, or if you leave in between, then like nowadays in MD and MBBS, they have this restriction. Is the same restriction applicable to the ones who are joining the PDCC course?
Not at Tata Medical Center, no.
So they can come in.
PDCC is flexible Parent Institute. So is the earlier, actually PDCC is without remuneration course. It was earlier. So that is also subject to the a host institute. So so they don't. So we don't have any bond with our host.
Do you provide any remuneration for the PDCC? No.
Yes, yes, that
Yes,
is
you
the same as the
the
TMC
fellows,
fellows.
as fellows,
Yeah.
right?
So but earlier we have had some fellows who have joined the PDCC course and just for the training and without, and they have worked for us without. We've had that, but then we have, as and when the TMC vacancy happened, we had inculcated them into the TMC fellowship and then started giving them salary. But now we have streamlined our acceptance process so that only the TMC fellows are taken into PDCC so that they all get a salary.
The entrance exam is of the MD level or slightly more difficult than that?
MD level, but with a focus on oncopathology. So we do give a stress to knowing basic grossing skills and cytology because we have a heavy load, and right from the start, we will have to have them be responsible for clinical duties. So if their idea of grossing is, or they haven't seen a specimen for 2 years, it's very difficult to yeah, accept them.
Right. Cytogenetics and molecular is not included in the curriculum.
In the academic lectures, it is, but in the clinical rotation, it's not. They are a separate lab and they have their own fellowship programs. That's not PDCC. And we allow formal training for 1 month sabbatical. That's only for second
The
year.
second year. Right. I think we are done and we are right on time to close this. Thank you so much, Dr. Roy, for taking out time to talk on this. This is something which many people would like to know and understand. So that opens a lot of avenues for them to look into post MD. Thank you so much for taking time. Thank
Thank
you.
you so
Bye
much
bye.
for the opportunity. It's my pleasure.
Anytime,
Thank
ma'am.
you.
The pleasure is all ours. Thank you so much. Bye bye.
Thank
Goodbye.
you. Bye
Take
bye.
care. Bye. Bye.
Bye bye.